Good morning, everyone. My name is Audra, and I will be today's webinar moderator. Welcome to today's webinar entitled Emotional Well-Being After Transplant, presented by Dr. Laura Labelle. Dr. Labelle is a clinical psychologist supporting the blood and marrow transplant and hematology clinics at the Tom Baker Cancer Center in Calgary. As a scientist practitioner working in the field of psychosocial oncology, she is passionate about providing evidence-based therapies to help patients and families adjust to illness and survivorship, reduce stress symptoms, improve mood, and enhance feelings of connectedness, purpose, and peace. In her work with patients, she integrates cognitive behavioral, mindfulness-based, and existential humanistic approaches, among others. Before we get started, I'd like to briefly go over the format for this webinar. There will be two parts, a 45-minute presentation segment and a 15-minute question and answer session. All phone lines will be placed on mute during the presentation. You may post written questions during the webinar by using the chat box located to the right of the slides. After the presentation, Dr. Labelle will answer all written questions. When there are no further written questions, I will take questions by phone. Should you experience technical difficulties, an operator can be reached by pressing star followed by 0 on your telephone. At this time, I would like to present you to today's speaker. Dr. Labelle, you may begin your presentation.
Thank you. Welcome, everybody. This is a lot of fun for me. I've never presented in this format, so here's hoping that everything goes smoothly. I am here to share with you about a topic that is near and dear to my heart, specifically talking today on the topic of emotional well-being after transplant. And when I talk about transplant, I'll refer to transplant or BMT or hematopoietic stem cell transplant, HSCT, you may see in my slides as well. They're interchangeable, just referring to the stem cell transplant. So my objectives today are to assist with your understanding of the emotional impact of cancer and stem cell transplant. Making sense of this experience in terms of what common patterns people go through emotionally, what is the emotional impact after the transplant, and how does that change, and also what strategies can be applied to help cope with those negative impacts, and I'll also refer to some of the positive changes that people can experience as well. So the strategies I'll talk about are evidence-based, and they will be primarily cognitive behavioral and mindfulness-based approaches. I'll also introduce some resources. A lot of what I'll talk about today does refer to things you can do now on your own independently, but that we know that professional support is very beneficial in helping people implement the strategies that I talk about. So I'll also make sure that I link you with appropriate support. I just want to talk first about what we know about emotional distress. And this is a study that was conducted in 2004, or published in 2004, and the study itself was conducted here at the Tom Baker Cancer Center in 2003. And it included all people who visited the Tom Baker for any reason, chemotherapy, for a clinic appointment, etc., during a 4-week period of time over that year. And so it did include people who were receiving bone marrow transplants or had received them. And the study showed that, looked at brief symptoms. It was a brief symptom questionnaire to look at symptoms that were experienced by patients, more than 2,500 patients, over that 4-week period. And what we found was that there were 37.8% of the individuals who reported distress or symptoms that landed in the clinically meaningful range. So that would mean that these symptoms or this level of distress were impacting their life, affecting their functioning, or causing significant distress. So that included predominantly fatigue as a symptom. That was the top rated symptom overall at 48.5%. And pain was also rated very highly by a significant proportion of individuals. 26.4% reported that pain was a significant symptom. And depression and anxiety were both identified in 24% of that population of patients. So when looking specifically at bone marrow transplant, This model represents the various common quality of life issues and how they relate in the context of a transplant. So how does the transplant impact quality of life? And quality of life is thought of in different domains of life. So how satisfied am I with the physical domain of my life, physical well-being and symptoms? How satisfied am I with my psychological well-being, social well-being, and spiritual well-being? And that encompasses quality of life. So you can see in this visual here that under each category, there are a number of concerns that are listed as to how the BMT can affect quality of life. Physically, significant impacts to strength and stamina, functional ability, visual disturbance or cataracts certainly affects functioning as well in the physical domain, recurrent colds and infections, possibility of infertility, and coping with chronic GVHD in early stages, the acute phase of GVHD or acute GVHD, but the long-term complications associated with chronic GVHD can range from mild to quite severe and quite impactful in terms of physical and emotional, social and spiritual well-being. And nutrition also falls in that category. Psychological well-being relates to the emotional experiences that are common after transplant, and these can range from anxiety, general worry, fear of recurrence specifically, as well as depression, feelings of hopelessness, feeling sad and down, feeling what's the point, having a decreased motivation to engage in activities that you'd normally enjoy, changes in priorities as well, so not necessarily a negative thing, but certainly still an adjustment and can be challenging in that regard to adjust emotionally to these changed priorities. Cognition and attention relate directly to psychological well-being, and we know that this area of functioning does often take a hit afterwards and takes a while to recover, for sure. Normalcy, sense of what is this new normal? And I'm sure you've heard that before, that this is a new normal, but yearning to regain what I had prior, or hoping to be at a certain place in my recovery. I want to get over to point B in my recovery, but I feel like I'm at point A still, or I'm in between, and it's how long is this going to take? Feelings of impatience, feeling of worry that I won't get there, worry that certain symptoms will continue on and become chronic or lifelong, and so there can be a heightened level of distress in relation to the difference between where I am currently in my recovery and where I want to be. Having sometimes positive feelings or difficult feelings around the notion that I've had a second chance, that I have a new immune system, I have a second chance at life, and that can have a host of emotions attached to it, ranging from gratitude and appreciation to guilt or survivor's guilt, or kind of a sense of reconsidering your life priorities, or now I really need to do something because I've been given this second chance, but that can feel like pressure at times as well. Coping with survival generally, I think, relates to all of the above. So fears about the future, though, what I commonly see, and we know is the case, is that two biggest factors that people are struggling with afterwards and before the transplant as well are uncertainty. So not knowing, an uncertain future around something that matters so much to you, and also a feeling of lack of control or unpredictability around what's going to happen. So my body will recover at its own pace. It will respond to the treatment, to the transplant, at its own rate. I try to prevent infection, but naturally being out and about, that I may be exposed to something, and I do have some control, but not complete control over that. That can make me sick. So also the element of having your medical team take such good care of you, that's wonderful, but at the same time you're handing much of your care over to others in doing that. And so again, a feeling of lack of control that can emerge. And then the intense physical, emotional needs related to the fact that there is a real risk of relapse for many people post. And or complications of treatment that do result in more mortality. So this is sometimes a significant fear that people are coping with that can often reduce over time as you gain more confidence and reassurance in your own body and from the team that you're doing well, but it's a significant concern for many people. And 30% will need to cope with lingering treatment-related complications and just learning to manage those complications so they are livable and you're able to carry forth with a satisfying and meaningful quality of life. In terms of social well-being relating to relationships, often this connects to how we feel we look. Changes in appearance can be quite pronounced, especially early on after the transplant. And that roles in relationships, especially in intimate relationships, can be affected as well. Changes in that dynamic that occur when there is a caregiver and a patient, so husband and wife, for example, moving to more of a patient and caregiver relationship for the purposes of the transplant and that acute recovery period. And then over time, shifting back to regain husband and wife can be a challenge. And navigating that. So caregiver burden is also a primary concern for both the caregiver but also the individual who receives the transplant. Leisure activities change, return to work as well, challenges certainly, and not everyone does or can return. Not everyone chooses to return to work, and not everyone can return to work after transplant. And there is a significant financial implication of that, obviously, as well. Spiritual well-being fits in as well. This is around concepts of hope and fear or despair. What is there to hope for? What is a realistic degree of hope? How do I make sense of what I've been through in terms of making meaning of it? I often see this after the fact for people who have been through the transplant and looking back on what they've been through and going, wow, what the heck did I just get through here, and what does that mean for me? What does it say about me and my future and the rest of my life? And so often people do find comfort in their religious or spiritual beliefs, but there is so much individual variability there as well around how big of a piece of your quality of life is encompassed by the spiritual domain. For some people it's huge and very significant. For others, it is relatively minor, but certainly an important piece to consider. So looking at the prevalence of emotional distress after transplant, distress levels tend to be highest before the transplant, actually at 35 to 50% of transplant recipients prior to the transplant report significant degree of emotional distress. And it is elevated, remains elevated afterwards in 22 to 43% of long-term survivors. And in terms of depression rates, we see that about 25 to 50% of BNT survivors report symptoms that are consistent with a significant degree of depression that is likely causing them distress or affecting their life. And so that would be 1 out of 3 individuals in the first year following the transplant. This is higher than the general rate in the general cancer population as well. We do know that this is one of the most intense treatments for cancer that an individual can go through. So that does make sense in that regard. Many studies though show normalization of mood and anxiety at 2 to 3 years out, but it does take time, and during that time there's a lot that you can do to support your emotional well-being, to encourage that normalization process. And certainly a big piece of this is also adjusting to the change and grieving losses. Even though a lot of changes and recovery will occur, if let's say somebody's a year out post-transplant and there are significant changes and losses that have occurred a year out, that even though there will continue to be recovery across those domains of quality of life, that currently at that 1 year mark that there are a number of losses that are being grieved. And grieving losses and adjusting to the change is important in terms of reconciling them and be able to make choices and respond in a way that actually is going to be helpful and beneficial. So again, about the uncertainty and loss of control on this slide. So I also want to mention that, it sounds like a lot of doom and gloom. It's very heavy what I've just talked about, just referring to the challenges, but I also see regularly in my office and also in the literature something called post-traumatic growth. And this is a concept, you've probably heard of post-traumatic stress. And post-traumatic growth is actually referring to the positive psychological changes that people experience as a result of exposure to traumatic or highly stressful, challenging events. And some transplant survivors report emotional growth beyond their pre-transplant levels. And this might include enhanced appreciation of life, improved relationships, feeling closer and more connected to the people in our lives, existential growth, so having a greater sense of what matters most to oneself, what gives the greatest sense of meaning and purpose, and I guess it's cliche, but not sweating the small stuff and finding ways to choose activities and choose to reinvest energy in the areas that matter the most and letting other things go. That can even include choosing certain relationships that you want to nurture and others that you maybe invested some time in before, but you really choose those that matter the most to you in terms of who you are. And then increased self-confidence and self-esteem can also occur where you can feel that you surmounted an incredible challenge and came out the other side and found some ways to make life good again. So that can increase confidence, and also feeling the support of those around you, feeling them step up and really hold you through a really challenging experience can help you feel better about yourself as well, maybe even more so than before. And factors that predict post-traumatic growth, because these factors are inconsistent across studies, but some of the research shows that female gender might make you more likely to experience post-traumatic growth, being younger and having higher levels of social support, as well as indicating that you are kind of a spiritual person, or all that meaning you recognize that certain things like connection, faith, and activities that give you a sense of meaning and purpose are important to you, and resilience, so the natural tendency to come through challenges and feel that you can navigate them successfully. So these factors may contribute to greater post-traumatic growth. I just wanted to touch on caregivers. I'm not sure whether there are actually caregivers on this call today, but to acknowledge that research suggests that among BMT caregivers, distress is highest pre-transplant as well, and then decreases over the transplant trajectory. And there's a growing body of evidence that shows the impact of cancer caregiving and BMT caregiving on caregiver distress. So the caregiver themselves may actually experience more distress than the individual receiving the transplant, and this bears out in the literature. So it's a different type of distress. It's a witnessing of your loved one going through something very difficult, often feeling a sense of responsibility for their well-being, and navigating a lot of roles along the way as caregiver, in addition to being a loved one, a support person in that sense emotionally, also navigating all the practical aspects of caregiving, being the secretary, the nurse, the chauffeur, the cook, etc., especially at that acute point of recovery where somebody who has just received a transplant is not able to do a lot of that and needs a lot more practical support. Caregivers often report feelings of loneliness and low levels of perceived social support. And so our service here, our counseling service, I'll talk about later, but we do offer support for the caregiver as well for these reasons. I want to briefly shift now. I'm going to move towards talking about coping, but this slide just highlights that really strong connection between emotional factors and physical symptoms. So the slide is focused around the vicious cycle of pain as a common symptom that may be experienced with GVH or peripheral neuropathy that is significant or related to tumors that are present or damage from tumors. So that pain is one of the most common concerns that we hear in coping with cancer and transplant, and is really connected to the emotional states that people are feeling. How you feel emotionally in general tends to follow alongside how you feel physically. So when you feel less well physically due to pain, fatigue, other physical concerns, nausea, that you are also more likely to feel down, anxious, and stressed. And that is a natural kind of connection that occurs. So pain is complex, and it's an individual experience as well, and it's often exacerbated by different factors. So for each individual, the cycle would look a little bit different, and different factors may be more or less important. But for example, a person has significant peripheral neuropathy and then is preoccupied with thoughts of pain, thoughts of the pain, like this pain will never get better, I'm never going to be able to walk comfortably again, I'm never going to get stronger, I'm not going to be able to cope with this pain. And often people will fear participating in previously enjoyed activities because they would worry about worsening the pain or injuring themselves. So there can be a withdrawal that occurs from activities that normally would boost your mood and help you feel more like yourself. But the fear and or the pain itself can prevent engaging in those activities. Also, people will become hypervigilant or look for signs or symptoms of pain. So really focusing in on that pain, it calls out to you and it grabs your attention, but that at the same time, more attention to the pain tends to exacerbate the pain. So pain management often relates to learning to relate differently to the experience of physical pain. But that hypervigilant focus on pain definitely can occur and exacerbate it. And low mood and pain often go hand in hand. So I'm having negative thoughts that this pain won't get better, that I won't be able to cope. That affects how I feel emotionally. I'm feeling more down, more frustrated, more worried about it. Maybe I'm not doing all the things that I could be. I'm pulling away from activities I normally enjoy, and that also negatively affects my mood. And then the pain becomes worse, so it gets to be in a vicious cycle. Also in that cycle includes role changes and relationship factors that affect our perceptions of pain or the meaning of pain, depending on how those around us respond to the pain. And then sexuality also can be impacted by pain, so again, intimate relationship and or be a part of the pain experience. So GVH can occur in the genital area, for example, and then have a significant relational impact in your intimate relationship. And your sense of self or self-image may be changed by the pain as well. So muscle tension, the more tense we are also physically, the more likely we are to feel pain as the muscles tense around that area of pain or compensate for where the pain is in the body, and that can also be a part of the vicious cycle. So to be aware of, for yourself, if pain is something that you're struggling with, to be aware of the factors that contribute to the pain experience and how emotion and physical symptoms may be linked. You can actually, the good news is you can break into this cycle at numerous points of entry. So working with increasing your communication in your relationship around what you're experiencing and your pain and your emotional experience and how that affects your relationship. That can be one point of entry to reduce the impact of the pain. Working with fears of pain that may exacerbate the pain itself, and also withdrawal that occurs out of activities you normally enjoy. So actually finding a way to re-engage in those activities in a way that is not going to aggravate, in a way that paces and is a reasonable expectation to place upon your body as well. So I'm going to talk now about the emotional impact. Now I see that I had some nice animation here, but perhaps that will not work on the slide, and that's just fine. But my point with this slide is to start from the place that it's clear that cancer and transplant and the treatments associated with that come with a wide range of difficult emotions. So emotional distress is often conceptualized as anxiety and depression. So that's really what this slide encompasses, and I'll focus in on today is really management of depression and anxiety. That these symptoms of depression and anxiety may range from mild to severe or anywhere in between, and can impact daily functioning to varying degrees. So the strategies I'll talk about today to manage mood and anxiety can be helpful wherever you are on that spectrum. So you may feel that you've been more in the mild or mild to moderate range in terms of feeling down and depressed, feeling really anxious and fearful, or maybe more on the moderate to severe range. So what we know about the strategies introduced today is that they can be helpful if you're in the mild range. It can be helpful in preventing depression and anxiety to apply some of these strategies. And if you are finding that you're having quite a lot of significant depression or anxiety, that these strategies are effective treatments, particularly if you're learning them in the context of a professional counseling relationship. So, at the top you see that there's commonly a situation that triggers depression, triggers anxiety. And in the case of cancer or transplant, it's not usually one incident or one stressful circumstance, but a series of them that are associated with cancer. And these are often losses or traumas that are experienced as chronic stressors. They may be related stressors as well, like social isolation or conflict in relationships, economic strain, financial strain, changes in work-related stressors. And then there are, if you look on the bottom left, physiological changes associated with the cancer or with the transplant and treatment that contribute to symptoms of depression and anxiety often. Altered sleep and fatigue are big ones in terms of mood. So probably the biggest factor for many people is the profound fatigue and difficulty sleeping that can occur after transplant. Low libido also can contribute to mood. Changes in brain and body chemistry related to pain, inflammation, or medication as well. So the medication that most commonly comes to my mind is steroids. So being on the prednisone, the longer-term high doses of steroids that can really have an emotional impact, and also coming off of those steroids. So as we go through this, I'll encourage you to reflect on what factors might play into your mood states, or your, in a personal sense, your experience. So depression, the emotional category there, the emotional box, depression often begins with feelings of discouragement and sadness as one attempts to deal with a difficult life situation. And these feelings of unhappiness, though, can give way to more severe and painful kinds of experience. So despair can occur, and a feeling of a pervasive mood of hopelessness and dejection, kind of feeling what's the point. A feeling of intense anxiety also can occur, where there's more significant physical tension and worry, or a sense of impending doom that often accompanies these depressed feelings. A sense of emotional numbness can occur, where I don't feel able to feel anything, and it's like a psychological pain has become so intense that your mind simply switches off your emotions like a circuit breaker. To say that it's very normal to have these kinds of emotions come and go, and some days that you feel more of one or another. Often we want to try to push our emotions away, right, and try not to feel them. But we know that the more that we label our feelings as bad and try to escape them and push them away or ignore them, the more entrenched they tend to get, actually. And in fact, research now tells us that the problem leading to anxiety and depression may not be that you actually have these negative thoughts, emotions, and memories, but that you try to force them away and avoid understanding and accepting them. So only when we can actually notice the feelings and pay attention to them and give them some space to be experienced, and putting them into words, can we then effectively respond to them in a healthy way? So emotions are like our inner barometer and our compass. And in order to feel better emotionally, we first have to always know what it is that we're feeling. I need to know where I'm at point A in order to get to point B in terms of my well-being. And then the box above referring to thoughts. So the emotions that we feel are often based in large part on the negative way of interpreting our lives. So everything we experience, whether it's internal, like pain, or external, something that is happening to us, such as, let's say, having some difficulty with returning to work or feeling pressure to do so, the content of our thoughts and the relationship that we have to our own thinking and our own mind significantly affects how we feel. Often there is a pattern of recurrent thinking about the losses experienced, and also about feared outcomes. So feeling consumed by thoughts, by fears, and by ruminating about losses that have occurred. Again, very normal and common to have those recurrent thoughts, those fears, but it's when we feel stuck there and can feel consumed by those thoughts that it can really take a toll emotionally and contribute to depression and anxiety in the long term. We get into different types of negative thinking habits, and I'll talk more about that in a bit. Also, harsh self-criticism. So the tendency that we all have, actually, a little green monster on our shoulders that jabbers negative labels at us and tells us maybe you're weak, or you're lazy, or you're not worthy. And that critic can get loud at times of stress, especially. Maybe quite quiet most of the time as we go through the life without active stressors, but it gets activated at times of stress, and it's helpful to learn to pay attention, to listen to what that critic is saying to you. And asking yourself how fair, how realistic, and how helpful are my thoughts. I'll talk more about that in a bit, but patterns of unfair thinking, unrealistic thinking, and unhelpful thinking can contribute to depression and anxiety. And lastly, behaviors. What are the actions that I engage in, the behaviors that keep me stuck, that contribute to depression? And maybe and I have a bit of an urge to turtle in my bed and withdraw from the world and isolate myself. So that social withdrawal is really common in depression. And reduced activity level. Not caring for yourself in terms of self-care. It can be from hygiene or nutrition, exercise. Patterns of unhelpful communication, and sometimes that comes out towards those that we love. And procrastination and avoidance. And excessive checking and reassurance seeking can occur as well. So all of these patterns tend to fall into what we call avoidant coping behaviors. So there are things in the short term that might give us a feeling of relief that we don't have to deal with a certain stressful feeling at that moment, but in the long term, they tend to feed into patterns of depression and anxiety. So again, helpful to understand what factors may contribute to your negative mood states, and these are points where you can make changes. Coping with depression specifically, I'll talk a bit about. So some of you may have heard about cognitive behavioral therapy, CBT, or cognitive behavioral stress management. And this is one of the gold standard non-pharmaceutical approaches to treating depression and anxiety and preventing relapse. Outside of cancer care, but also inside of cancer care, this is an approach that's often applied when you see a counselor. So first, the important piece I mentioned earlier about noticing what you're feeling. So I wish we could just tell ourselves to feel a certain way. I wish we could just tell ourselves to, you'll be fine, just relax, stay positive, be cheerful, put on a smile. It doesn't work to tell ourselves to feel something different than what we're feeling. We're already feeling it. It's already there. In fact, it can be counterproductive to suppress, push down, deny, and try to cover up these feelings. So noticing first what we feel, then asking, what are the patterns of thinking and patterns of behavior that contribute to this feeling? These are patterns that you can work on challenging and replacing with more helpful patterns. Behaviorally, this often looks like, on the right-hand side, reactivating your life. So counteracting the social withdrawal and the reduced activity level, and re-engaging in activities in a realistic and planful way, choosing activities that matter to you, and preventing the social isolation that contributes to depression over the long term. Problem solving and assertive communication are other important components in terms of behaviors. I won't have time to get into today, though. And then the left-hand side, we're talking about the thoughts, the patterns of thinking that contribute to depression. We're not talking about positive thinking here. It is about learning to think realistically, in a balanced way, in a fair way, and really understanding that thoughts are not facts. Thoughts are not facts. They are merely passing events in the mind, and they may range anywhere from totally realistic, 100% realistic and true, to 0% true and realistic. But most of the time we don't question our thoughts. We just react in the moment, and that's why we actually think of them as automatic thoughts in CBT. They happen quite automatically and affect how we feel. So I'm going to talk first for a couple of minutes about behavioral activation. So behavioral activation is one way of addressing the vicious cycle that you see up on the right-hand corner there that can occur around depression, fatigue, inactivity, and pain. Pain may or may not be a component of that. And that behavioral activation is demonstrated to effectively break this cycle and is one of the most essential ingredients in terms of cognitive behavioral therapy being effective. What this means is that you would look at regularly scheduling and engaging in rewarding activities that give you a sense of pleasure and or accomplishment. Give you that feeling of enjoyment, that is, like something you enjoy, and it might be watching your favorite movie or having coffee with a friend, or it might be something that you get that feeling of, yes, I checked it off my list, I did it, it's been on there for a while. That could be from cleaning out a sock drawer to chopping some vegetables for dinner. But all of the activities in our life you can think of as landing somewhere on a scale of 0 to 10, somewhere on that scale for pleasure, and 0 to 10 somewhere on the scale for accomplishment. So trying to choose an activity each day that falls in the 5 to 10 range, that yes, this is something I really do enjoy, and scheduling those activities in each day. Or this is something I don't really enjoy as much, but I sure feel good after I do it. And that feeling of accomplishment, again, greater than 5 out of 10, that it does give me that feeling. Exercise is also an important category to include in there when you're planning your activities, and making sure that you're not lacking in any of these areas: exercise, social activity, and interaction. Small duties, meaning those are often the to-dos on your list that you might avoid, self-care, and rewarding activities. I just want to mention a few things in choosing activities. We know that the best way to reduce anxiety and depression and to make long-term changes in your life is by looking at how you spend your time and understanding what is important in your life, that is your values, and then changing the nature of the activities that you're engaged in to make your behaviors more consistent with your values and goals. So again, it comes back to what are those activities that fulfill me or that are in that area of my life that matters a lot to me. Making sure that you have those things scheduled into your day or into your week. And sometimes it means breaking things down into quite small chunks in order to make it realistic. You might have a goal of creating, a photo book or something. The thought of it just seems overwhelming, so that you schedule, one day you just schedule going to the website and logging in. And that's all you do. but breaking it into manageable chunks is very important. And also to remember that activity comes before changes in mood. So if you wait until you feel like it, you're in the mood to do something, it may or may not occur. Whereas if you start doing something, then the mood changes will come afterward. So same thing with motivation. We have a tendency to think, well, when I feel like it, then when I have enough energy, when I am in the mood or I have that motivation, then I'll be able to do it. I'm just not there today. But it's actually that in the doing of it, in the starting of it, that we get the motivation to keep going and to get the reward of doing it. So it's kind of the Nike slogan, just do it. And remembering that if you wait, that you're missing an opportunity. What are you saying no to in that moment? The other consideration that's huge is considering energy conservation and pacing, and it's a very difficult balance, especially early on after a transplant where you're feeling so weak or still have ongoing symptoms. Finding a pace and re-engaging in life, though, in a way that works for you, so your symptoms aren't aggravated. That people will tell me, yeah, I did that, but then I was out for 2 or 3 days afterwards. I just couldn't leave the house. I was so exhausted. So it is a bit like navigating a canoe down a river and in between two banks of a river, moving to one side and maybe bumping into the riverbank and readjusting. And so we hope that we don't bump into riverbanks, but it does sometimes happen as you figure that out because it's a moving target as well in terms of energy levels in recovery and other symptoms in recovery. I'm just going to mention one element of looking at thoughts, and that is that people sometimes share with me the feeling that they are so tired of others telling them to stay positive. So when we're looking at challenging thoughts that drive negative emotions, it's very different from having positive thoughts. A lot of people will say, I'm so tired, I'm tired of putting on a smile, a brave face, it's exhausting, it makes me just want to stay home. I hear stay positive, it drives me crazy. The other side of that coin is the internal dialogue around, I just have to stay positive. I have to stay positive for a number of reasons. And I had a patient talk about it as being the prison of positive thinking. So I have to be positive or else people will feel sad or they'll feel uncomfortable or pity me or no one will want to be around me, I'll drag them down. Or it means I'm not coping if I'm not positive. I have to think positive or else I'm weak or I'll go crazy, I'll just lose it if I don't think positive. Or I have to think positive because the cancer will come back or progress. So it's important to recognize that these are assumptions that people make or that you may be making, and to remember that thoughts are not facts. And recognize if you do resonate with any of these thoughts, that how do these thoughts make you feel right now as you have that thought? The power of the thinking pattern itself in affecting how we feel. So the goal with coping with emotions is not to have positive thoughts, but to have a balanced perspective and to relate to our thoughts in a way that does not consume us. And I see that we're getting to our 45-minute mark. So I'm trying to think of what might be most helpful for you today. And it might be just to skip through, because to allow time for questions, to talk a bit about mindfulness for 1 minute here. Because mindfulness is, in addition to the cognitive behavioral approach, is another powerful set of techniques or another evidence-based approach that is shown to address or help people with the sense of uncertainty and lack of control associated with illness and its symptoms and side effects. So many of you have probably heard at some point about mindfulness or meditation. You see it a lot in the popular media these days. It comes originally from Buddhism, but the interest in mindfulness has developed in the West as being removed from its Buddhist roots And it's grown exponentially in healthcare settings and research labs around the world. So what is mindfulness? It is about developing awareness of all that is happening in the present moment. It is moment-to-moment, non-judgmental awareness of thoughts, feelings, physical sensations, focusing on the present rather than the past or the future. So most of the time our minds are racing into the future, worrying about the future, or ruminating about the past, and very seldom are we actually here in the present moment. And what can happen is when we are in the present, worry and rumination can fall away, and that there can be an awareness of what we're feeling and what we need, and an understanding about the true nature of our mind and our bodies in a way that we can then, rather than reacting automatically in automatic pilot, where we tend to miss or ignore or lose control of our mind and body, that we are in a position to more mindfully respond, replacing habitual reactions with healthier responses that foster well-being, and also having more of a sense of agency and control in our lives. So we offer a program that teaches mindfulness meditation here at the Tom Baker, and it runs 3 times a year. And if you're interested in that program, or if you would be interested in working with a professional specialized in cancer care and bone marrow transplant, such as myself, I encourage you to contact our department and book an appointment with us. I have the phone number up on the screen there, and you can call that if you are wanting to know more. This is a part of healthcare. There is no cost for any of our services. And some other resources there in terms of mindfulness CDs online, as well as that you can order, as well as the mindfulness research that we've conducted in our setting here at the Tom Baker. And there are a couple of books as well we recommend. A couple of books on mindfulness that you can find here at the Tom Baker Library, as well as some resources for distress management. A Cancer Patient's Guide to Overcoming Depression and Anxiety is a great one, and some others that are not specific to transplant or cancer, but are excellent resources for helping with mood. There's also a free skills workbook available online that I like to refer people to. So at this point, I will take questions with the apology that we have 10 minutes, it looks like, rather than 15.
Thank you. That concludes the presentation segment of the webinar. We will now begin our Q&A session by addressing questions submitted via the chat box. We will give participants a minute or 2 to submit their questions. After we have answered these, we will take questions by phone. Please bear in mind that all questions will be broadcast to the entire webinar. Speakers will not be able to comment on the care of specific patients. Please refrain from asking specific personal care questions.
So I assume I read the question. Will the deck be posted somewhere to reference? And perhaps the organizer can respond about that.
Yes, we'll be putting the slide deck and the recording of this on the website.
That's great, because I didn't get to a couple of my examples, which you can read about as you go through the slide deck again on your own. You're welcome.
And if there are no further written questions, we can move to the phone lines. If you would like to ask a question, please press star and the number 1. Again, that is star 1 if you would like to ask a question on the phones. And Dr. Labelle, at this time it appears there are no questions on the phone.
Okay. So I guess this would conclude the talk today. Please don't hesitate to connect with us, and I would be happy to meet with anybody who would like to arrange a counseling session as well, so feel free to connect.
Once again, we would like to thank you for joining today's webinar presented by the CBMTG. We would like to alert you that a webinar evaluation will be sent to you via email following this presentation. Your feedback is important to us, and we hope you will complete the webinar evaluation. The next CBMTG patient and family webinar will take place on November 21st, presented by Megan Morrison and Connie Ziembicki, entitled Nutrition After Transplant. Thank you all for joining us today. We sincerely appreciate your attendance.